Namaskar दोस्तों, I am Purnima from Fertility Dost. Welcome to our another special session with Fertility Dost, and obviously our partner in spreading awareness is UNS for this session. Thank you UNS for arranging such wonderful sessions with top most fertility specialists around India. So viewers, today we have a topic related to how to optimize natural pregnancy. अगर हम सोचें तो इस भाग-दौड़ की दुनिया में अपनी जॉब, अपनी फैमिली, अपनी स्टडीज़ कुछ ना कुछ करते कहीं न कहीं एक जो फैमिली प्लानिंग का टाइम है वो थोड़ा पीछे छूट जाता है। एंड व्हेन वी स्टार्ट थिंकिंग अबाउट दिस कि चलो अब प्लान करते हैं, तो लगता है कि कहीं टाइम रह गया। अब सही वक़्त नहीं है, एज बढ़ गई है, रिस्पॉन्सिबिलिटीज़ बढ़ गई हैं एंड देन वी जस्ट थिंक कि कुछ हो नहीं रहा है तो एकदम से फर्टिलिटी स्पेशलिस्ट के पास पहुंच जाते हैं हम। बट वी वांट यू टू फर्स्ट थिंक ऑफ नेचुरल प्रेगनेंसी। वो कहते हैं ना, नेचुरल कंसेप्शन जैसा कुछ नहीं है। वी आर नॉट सेइंग दैट आईवीएफ प्रेगनेंसीज आर नॉट गुड, बट अगर आप नेचुरली कंसीव करते हैं देन इट वुड बी द बेस्टेस्ट थिंग फॉर यू। तभी हमने सोचा कि आज का हम टॉपिक इसी से रिलेटेड लेकर आते हैं कि इन केस यू आर प्लानिंग for a family, then what to do and when to do, because time is really an important thing. समय से कीजिए, कैसे कीजिए, कौन सा डॉक्टर चूज कीजिए और क्या सच में एकदम से भागने की जरूरत है हमको आईयूआई और आईवीएफ के लिए। सो राइट टाइम, राइट डॉक्टर एंड राइट डिसीजंस सबसे इम्पोर्टेंट चीजें। आज हम इन्हीं सब बातों को डिस्कस करेंगे एंड टू डिस्कस दिस वी हैव डॉक्टर शालू गुप्ता with us, and she's from Cloud9 Gurgaon. So let me call Dr. Shalu on the main screen, and then after giving proper introduction, we'll start the session. नमस्कार मैम, गुड इवनिंग।
नमस्कार पूर्णिमा, कैसी हैं आप?
बिल्कुल ठीक।
अच्छा,
डॉक्टर
फर्टिलिटी दोस्तों पे आज जितने भी हमारे व्यूअर्स हैं उन सबको मेरा नमस्कार है।
थैंक यू मैम, थैंक यू सो मच फॉर ज्वाइनिंग टुडे। एंड व्यूअर्स, आपको बता दें कि डॉक्टर शालू इज अ वेरी नोन नेम इन दिल्ली एनसीआर। तो दिल्ली एनसीआर के जितने भी व्यूअर्स हैं, इस सेशन के बीच में या सेशन के बाद आपको लगता है दैट यू नीड अ कंसल्टेशन विद डॉक्टर शालू, प्लीज लेट अस नो। आप विजिट करना चाहते हैं जरूर कीजिए, बिकॉज डॉक्टर शालू का एक्सपीरियंस अगर हम बात करें तो इट्स मोर देन 12 ईयर्स इन दिस। एंड गुड़गांव में तो अगर हम नाम लें तो लोगों का पहला नाम ही जो ऊपर आता है वो डॉक्टर शालू का है। डॉक्टर शालू, आई एम ऑल्सो फ्रॉम गुड़गांव।
अच्छा, इट्स नाइस टू हियर फ्रॉम यू।
राइट,
नहीं, ऐसा नहीं है, आई डोंट नो। थैंक यू फॉर योर मतलब जैसे
बिल्कुल। हाँ,
इंट्रोडक्शन, काइंड इंट्रोडक्शन आई वुड से पूर्णिमा।
We have many members who are from Gurgaon and they are talking about you. लोगों का कहना है कि डॉक्टर शालू का डायग्नोसिस इज वेरी गुड। डॉक्टर शालू हर केस को बहुत अच्छे से समझते हैं एंड डॉक्टर कहीं ना कहीं हर किसी पेशेंट को, आई वुड से दैट ये बहुत ज़रूरी एक इम्पॉर्टेंट फैक्टर है, बिकॉज डायग्नोसिस इज द बेस्ट पार्ट दैट यू नीड टू डू एट बेस्ट। बिकॉज जब हम फर्टिलिटी स्पेशलिस्ट के पास जाते हैं, हम खुद से ही बहुत उलझे हुए, घबराए हुए से होते हैं,
बिल्कुल
बिकॉज
ठीक है।
यू नो कि हमारी आज की सोसाइटी में भी एक फर्टिलिटी सेंटर को विजिट करना अच्छा नहीं माना जाता।
वेरी ट्रू, वेरी ट्रू।
सो
अच्छा पूर्णिमा,
व्यूअर्स, हाँ जी, हाँ जी, प्लीज बोलिए।
दिस टॉपिक इज वेरी क्लोज टू माई हार्ट एक्चुअली, बिकॉज मुझे लगता है कि जितना हम नेचुरली हम कर सकें चांसेस, बिकॉज आईवीएफ या आईयू इज नॉट 100%, तो ये हमें
राइट,
बहुत स्ट्रेस कॉज करता है। और वही वाली बात है, कहावत होती है, क्या पछताना जब चिड़िया चुग गई खेत। तो व्हेन दे आर प्लानिंग, अगर दे प्लान प्रॉपरली कर लें तो काफ़ी सारे पेशेंट्स हमारे प्रेग्नेंट हो जाते हैं। तो जब आते हैं, अच्छा मैम हमें तो ये भी नहीं पता था, अच्छा, तो मुझे लगता है कि अगर हम उन्हें समझाएं कि भाई जब तुम करना शुरू कर रहे हो या जब सोच भी नहीं रहे हो, बट यू आर नॉट,
राइट,
मतलब देयर आर लॉट ऑफ पेशेंट्स हु आर सोच भी नहीं रहे होते हैं, बट दे आर नॉट यूजिंग एनी कॉन्ट्रासेप्शन भी नहीं यूज कर रहे होते हैं। तो उनको समझ ही नहीं आया भाई नहीं कर रहे हो तो बेटर है कि थोड़ा सा सोच के अगर प्लान कर लो तो हो सकता है प्रेगनेंसी आ जाए। सो देयर लॉट ऑफ टाइम्स दे आर नॉट इवन थिंकिंग, दे आर वांटिंग अ प्रेगनेंसी, बट भाई आ गई तो ठीक है, तो अगर आ गई तो
राइट।
ठीक है, मे बी अगर वो कोशिश करें तो हो सकता है उनकी आ जाए, मतलब उस तरह से प्लानिंग करके चलें अपने आप को, तो मतलब अपनी सब चीज़ें ठीक करके चलें तो।
राइट। एंड आज डॉक्टर शालू कहीं ना कहीं हम इसी चीज को एम्फसाइज करके चलेंगे। व्हेन यू स्टार्ट प्लानिंग, इट्स नॉट ऑलवेज दैट योर जर्नी स्टॉप एट फर्टिलिटी क्लिनिक। ऐसा नहीं है, ये
नहीं,
कहीं ना कहीं
नहीं,
लोग सोचते हैं, बेशक वो मेल इनफर्टिलिटी केसेस हो, फीमेल इनफर्टिलिटी हो, और कहीं ना कहीं अनएक्सप्लेन्ड जो वर्ड है वो काफी
हाँ,
डराने वाला है। सो
बिल्कुल ठीक।
डॉक्टर, आपसे शुरू करते हैं कि what you suggest for such couples के when they are thinking about this pregnancy conception, तो what all factors they should consider?
सीखो, सबसे पहले जो पूर्णिमा आती है हमारी एज, स्पेशली द फीमेल की एज। जो देखने में आया है वो कि जो फीमेल्स हुआ यंगर देन 35 ईयर्स ऑफ एज, दे हैव अ हायर फर्टिलिटी। जैसे जैसे हमारी एज बढ़ती जाती है, स्पेशली 35-37 के ऊपर, हमारी फर्टिलिटी जो अराउंड 20-30 ईयर्स की एज में हमारी फर्टिलिटी होती है, वो ऑलमोस्ट 50% रह जाती है। साथ में फर्टिलिटी कम हो गई, चांसेस ऑफ प्रेगनेंसी लॉस, अबॉर्शन, ये सब चीज़ें बढ़ जाते हैं। हमारे एग नंबर्स कम होने लगते हैं, उनकी क्वालिटी डिटोरेट होने लगती है। तो ये सब जो प्रेगनेंसी आने का जो वो होता है चांसेस, वो सब कम होने लगते हैं। सो मोस्ट इंपॉर्टेंट होता है फीमेल की एज। लकीली फॉर द मेन, उनकी जो फर्टिलिटी होती है दैट डिक्रीजेज व्हेन दे क्रॉस अराउंड 45-50 के ईयर्स की एज हो जाती है। बट अनफॉर्चुनेटली हम फीमेल्स की जो प्रेगनेंसी होती है, जैसे ही हमने 35 क्रॉस किया, इट स्टार्ट फॉलिंग ड्रास्टिकली। और
Right.
पर्से जो इंडियन फीमेल्स होती हैं, हमारी जो काउंटर पार्ट्स है कॉकेशियंस, जो इंग्लिश फीमेल्स होती हैं, उनसे फर्टिलिटी हमारी कम होती है। हो सकता है ये हमारा जेनेटिक हो सकता है हमारा इन्वायरमेंट हो सकता है हमारे खान रहन सहन खान पीन का भी प्रॉब्लम हो सकती है।
Right.
सेकेंडली हमें देखना चाहिए कि भाई हमारी कितनी एज है, क्या है। तो इफ़ यू आर अ यंग पेशेंट, यू कैन ईजिली प्लान, ट्राई फॉर अ होल ईयर बिफोर यू गो टू अ डॉक्टर। And secondly, if you're more than 35, try for 6 months. You are not getting conceived. Get your blood test and everything done properly. Secondly, the female, once she is planning कि भाई अब मुझे pregnancy plan करनी है, तो get your blood test done. All your blood test, all the investigation to see that you are healthy, so that pregnancy comes in a healthy mother. It's not, I'm talking not talking about fertility. As a healthy woman, yes, I'm healthy. My hemoglobin is okay. My sugars are okay. My thyroid is okay. So these are the basic tests which we are looking for in a patient. And if everything is okay, that means you're healthy. Just plan
Right.
out. And in case you're suffering from any medical problems, like you have a thyroid or your diabetes, your hypertension, make sure that you're taking all those medications which are helpful during the which डू नॉट इफेक्ट एडवर्सली इफेक्ट आपकी प्रेगनेंसी को इफेक्ट नहीं करती हैं, एंड सब चीज़ें आपकी अंडर कंट्रोल हो, एंड देन यू कैन इमीडिएटली प्लान योर प्रेगनेंसी हियर। सो प्लस खाने का, अब अगर कोई ज़्यादा ओवरवेट है फीमेल, तो वो शी कैन वॉक एंड डू हर एक्सरसाइजेज, टेक हर डाइट प्लान्स टू रिड्यूस हर वेट। एंड समटाइम्स पेशेंट्स आर वेरी थिन लीन, बिल बहुत पतले होते हैं, तो दे कैन add some things like proteins and everything in the डाइट, जिससे उनका थोड़ा सा वेट बढ़ जाए। बिकॉज वेट भी शुड बी ऑल्सो ऑप्टिमाइज्ड। कोशिश कर देखो, वी कैन नॉट से वेट लूजिंग इज एंड वेट गेनिंग, जिसका नहीं होता उसको बहुत मुश्किल से होता है, जिसका लूज नहीं होता मुश्किल, कोशिश तो करनी चाहिए, दैट इज व्हाट मैं थिंक। और जो
Right.
खाने में होता है, अगर इफ यू go through net, you will get lot of things which comes up. Basic what I tell my patients is, do not eat sweets, ऑयली फूड, पॉलीसैचुरेटेड जो फैट्स होते हैं, ऑयल्स होते हैं, ये कम कर दो। मीट इनटेक, स्पेशली एनिमल प्रोटीन अपना कम कर दो। गो फॉर मोर ऑफ वेजिटेबल्स, सैलड, सीड्स, एंड दीज फूड्स विच विल गोइंग टू इंक्रीज ऑन यू कैन गो। सीड्स भी आजकल बहुत सारे तरह के आने लगे, दे कैन हैव दैट, दे ऑल एवरीथिंग इज रिच इन एंटीऑक्सीडेंट्स, so they can go with all these kind of foods which increases their fertility potential. This goes for both male as well as the females.
Right. So we can summarize the whole thing that healthy eating, हमें सबको पता है कि अच्छा खाना चाहिए, टाइम पे खाना चाहिए, बट वही है, कहीं ना कहीं वी थिंक अबाउट इट कि नहीं। सो डॉक्टर शालू, आपने एक बहुत इंटरेस्टिंग पॉइंट बोला कि मेल्स की फर्टिलिटी में ड्रॉप बहुत लेट आता है। सो अगर हमारे पास कुछ ऐसे केसेस हैं जिसमें मेल्स की फर्टिलिटी में ड्रॉप जल्दी आ गया, मान लीजिए स्पर्म काउंट में इश्यूज हैं, मोटिलिटी में है, तो व्हाट यू सजेस्ट फॉर सच केसेस, लाइक उनका प्रोटोकॉल मेडिसिन, और कितनी देर तक मेडिसिन लेके दे कैन
First,
ट्राई फॉर नेचुरल?
पूर्णिमा इट डिपेंड्स अपॉन कि कितना ड्रॉप है. अगर बहुत सिवियर ड्रॉप है तब तो
हम्म.
हमें फिर वी नीड टू वर्क अबाउट कि क्यों प्रॉब्लम्स आ रही है, क्या आ रही है. बट अगर कोई माइल्ड सा ड्रॉप है ना, सो नॉर्मली आई टेल देम नॉट टू कीप, जो मेल्स को मैं कहती हूँ, ट्राई नॉट टू कीप द लैपटॉप्स ऑन द लैप्स. तो
ओके.
मेल्स जो होते हैं दे नॉर्मली ट्राई टू 80% मेल, काफ़ी सारे मेल्स जो होते हैं अपना लैपटॉप लैप पे रखते हैं. एंड उसके कारण जो वहाँ पे जो हीट जनरेट होती है वो टेस्टिस पे जाती है. तो टेस्टिकुलर एरिया
राइट.
जहाँ पे स्पर्म प्रोडक्शन होता है वहाँ पे हीट हो गई. टेस्टिस जो एरिया होता है जहाँ पे स्पर्म प्रोडक्शन, दैट हैज बीन why God has put it outside the body. It is not outside the body, inside the body. Why it has been put outside? Because that area, जो scrotal area होता है जहाँ पे testes produce, sperms produce होते हैं, it needs to be have a lower temperature.
ओके.
ठीक है. उसका जो टेम्परेचर होता है बॉडी टेम्परेचर से 1 या 2 डिग्री कम होता है. तो उससे स्पर्म प्रोडक्शन अच्छा होता है. अब हम यहीं पे पूरे टाइम अपना लैपटॉप यहीं रखे रहेंगे तो वहाँ पे हीट जनरेट हो गई. तो टेस्टिकुलर टेम्परेचर जो हो गया बिल्टअप हो गया. तो दैट ऑल्सो कॉजेज अ प्रॉब्लम इन द स्पर्म प्रोडक्शन. सेकेंडली, टू वेयर बॉक्सर शॉर्ट्स, बिकॉज बॉक्सर शॉर्ट्स पहनते हैं, एक्सरसाइज करके आए, टेक अ बाथ, वेयर अ बॉक्सर शॉर्ट, सो दैट द सर्कुलेशन ऑफ द एयर अराउंड द टेस्टिकुलर एरिया जहाँ पे स्पर्म प्रोडक्शन है, तो वो होगा तो टेम्परेचर ऑटोमेटिकली फॉल हो जाएगा. तो देन इट विल हेल्प यू इन दैट काइंड ऑफ. प्लस एक बहुत नोशन होता है कि भाई हम इजैकुलेट नहीं करेंगे, हम लंबे लंबे टाइम तक रिलेशनशिप नहीं करेंगे तो स्पर्म की क्वालिटी इंप्रूव हो जाएगी, काउंट इंप्रूव होगा. ऐसा नहीं है. ये एक बहुत बड़ा मिसकंसेप्शन है. पीपल डू नॉट हैव रिलेशनशिप फॉर 10-12 days कि भाई ना हम फर्टिलिटी टाइम पे ही करेंगे
राइट.
तो फिर
राइट.
स्पर्म
राइट.
काउंट हमारा बहुत ज़्यादा अच्छा हो जाएगा. ऐसा नहीं है. they need to understand that they need to ejaculate every third day because sperms is outside the body. जब तक आप ejaculate नहीं करेंगे sperms will not be discarded and sperm has a life of 3 days. 3 days के बाद तो sperm वहीं खत्म हो जाते हैं. Storage area for the dead sperm and the live sperm is same. If you don't ejaculate your sperm तो dead sperm will start accumulating. तो live sperms जो हैं वो dead sperms के पास आ गए. तो हम क्या करते हैं, जब नॉर्मल सी चीज़ है घर में भी हम जो सब्जियां थोड़ी, लेट्स इज अ वेरी ले मैन एग्जाम्पल, हम वेजिटेबल्स, अच्छी वेजिटेबल्स, साफ वेजिटेबल्स और पुरानी अलग अलग रखते हैं ना. सबको मिक्स तो
राइट.
नहीं करते. क्यों, हमें मालूम है कि भाई हमारी फ्रेश वेजिटेबल्स खराब वाली वेजिटेबल खराब हो जाएंगी. तो सेम गोज विद द स्पर्म्स ऑल्सो. तो इफ द स्पर्म विच इज अ डेड स्पर्म की क्वांटिटी जब बढ़ जाएगी, जब हम नहीं करते, हम लॉन्ग गैप्स रखते हैं रिलेशनशिप में या एब्सटिनेंस में, तो क्या होगा, तो हमारे जो फ्रेश स्पर्म्स होते हैं, जो लाइव स्पर्म्स होते हैं, उनकी क्वालिटी खराब हो जाती है. तो वो प्रेगनेंसी हमें नहीं देते हैं. So long gaps for the males is not a good thing. So you must have heard about word like DNA fragmentation, genetic
राइट. वेरी
abnormalities in the
कॉमन.
sperm. So that
राइट.
also increases in the sperms. So I'll give you an example. One of my patients, they came with a report with me for having a sperm DNA fragmentation of 80%. So normally हम मान के चलते 15% is supposed to be या 20% is taken. So the problem with that guy was that he was not ejaculating. He was feeling कि नहीं मैम मेरे को कि वो है. तो when we started making him do this every third day, fourth day या relationship रखो या masturbate, then after 3 months when we repeated his DNA fragmentation, it came out very nice. It came just 15%, and he was not conceiving because of that thing.
बिकॉज
Even
ऑफ
his
दैट.
IUS and IVF, he was not forming good embryos. Then when we his this he did a small simple technique instead of having all those medications. So he came out nice. Matlab she is pregnant now and delivered also. So I felt
ग्रेट.
कि these small things which help you out. तो हमारे जो notion होता है, तो that is one of these notions. Long gaps is there.
राइट. दिस आई डू एग्री विद यू डॉक्टर शालू, बिकॉज हमारे पास भी कितने क्लाइंट्स इसी को लेके कि मैम हम तो वेट कर रहे हैं जिस दिन फर्टाइल डेज होंगे, तो वी यूजुअली
Hmm.
गाइड देम दैट प्लीज डोंट वेट फॉर फर्टाइल डेज.
Fertile
एंड आई
period.
थिंक
Yeah.
इस सेशन के बाद और आपका ये केस सुनने के बाद तो पीपल विल रियलाइज
Hmm.
कि हमें whether you are like making the relationship, maintaining relationship with your partner, or whether you are masturbating, but please ejaculate. That is really important for a healthy sperm. Right.
Sperm plus infection भी नहीं होगा ना, prostate infection and all that infection, because dead sperm will act like a media for bacteria to grow.
Right. Right.
तो वो फिर
Right.
मेल्स के इन्फेक्शन जो होते हैं, जेनेटल इन्फेक्शन जो होते हैं, वो भी नहीं होते, सेक्सुअल इन्फेक्शन भी कम होते हैं उनके.
Right. And Dr. Shalu, हमारे पास जैसे एक query है related to white discharge. So is it really possible that this regular white discharge could be the reason for infertility or not
पूर्णिमा,
concept?
जो वाइट डिस्चार्ज होता है ना, ये हमारी बॉडी में नॉर्मली होता है. ठीक है। द
ओके।
वाइट डिस्चार्ज, जैसे हमारा पीरियड्स खत्म हुए, देर इज अ 4-5 days गैप जब वाइट डिस्चार्ज नहीं होता, पर जैसे जैसे
हम्म
हमारा एग ग्रो करने लगता है तो वाइट डिस्चार्ज आने लगता है, बिकॉज दिस वाइट डिस्चार्ज इज अ साइन कि हमारा एग ग्रो कर रहा है. This white discharge is kind of little transparent and little like a elastic which will stretch out, stretchable
हम्म
होता है. This white discharge is transparent because it will try to catch the sperms. It becomes maximum when the ovulation happen, and then the quality of this white discharge become, which is transparent and little sticky kind of a white discharge, becomes white and non sticky. तो white और non sticky का मतलब होता है कि वो वहाँ पे प्लग की तरह काम करता है to prevent
हम्म
the sperms from or any infection going up, because the sperms have now gone up post ovulation. This transparent sticky discharge becomes a white discharge, which once when the periods are about to come, this discharge disappears, and then you get 4-5 days कोई discharge नहीं होता, and you get the periods. So
हम्म
discharge per se is normal for human female vagina, as long as it is not causing you any itching, and it is not causing you any burning sensation, itching, या smell नहीं आ रही है. Then as long as it's the two things which you need to understand, smell
हम्म
or
हम्म
itching. और
राइट।
जैसे पेशेंट्स हमें जो कहते हैं कि जलन हो रही है करने में, अगर ये दोनों चीज़ें नहीं है, स्मेल भी नहीं है वो, तो इट इज़ अ हेल्दी नॉर्मल वजाइनल डिस्चार्ज.
Okay. So, if you are having white discharge, then you need to understand the period cycle days. उसी के
हाँ,
accordingly आपका
हाँ,
discharge है.
हाँ. और
Right.
दूसरी चीज़, अगर इचिंग नहीं है और स्मेल नहीं है, तो देन यू कैन जस्ट इग्नोर इट, सेइंग दैट इट इज़ अ नॉर्मल हेल्दी वजाइनल डिस्चार्ज.
Right. And next query we have Dr. Shalu with us regarding the clots during menstrual flow. क्या क्लॉट्स आने आपके पीरियड्स के टाइम पे इंडिकेट करते हैं कि आपका पीरियड्स में गड़बड़ है, हार्मोनल डिसबैलेंस है?
नहीं, नहीं. जो
ऐसा कुछ
साइकिल
नहीं।
लेंथ होती है, जो पीरियड की साइकिल लेंथ होती है, इट कैन बी एनीथिंग बिटवीन डे 21 से लेकर 35, विच इज़ नॉर्मल. अगर
हुँ,
इससे शॉर्ट साइकिल है 21 डेज से, या 35 डेज से ज़्यादा साइकिल है, तो वो एबनॉर्मल मेंस्ट्रुअल साइकिल होती है. बट क्लॉट्स पर से इट इज़ नॉट अ प्रॉब्लम अनटिल अनलेस बहुत हैवी ब्लीडिंग ना हो, जिसके कारण पेशेंट अनीमिक ना हो जाए,
ओके,
पेशेंट का
राइट,
हीमोग्लोबिन लो ना हो जाए. अगर ब्लीडिंग क्लॉट्स है, अपने आप से 2 दिन में खत्म हो जाते हैं, एंड इट इज़ नॉट कॉजिंग यू हैविंग लो हीमोग्लोबिन या अनीमिया नहीं कॉज कर रही, देन इट्स फाइन, नो प्रॉब्लम्स देयर.
राइट. So one very common query and again people are asking about AMH because आजकल सबसे पहला टेस्ट जो भी होता है वो AMH पे जाता है एंड आई डोंट नो कि मतलब आज से कुछ साल पहले शायद कोई बात ही नहीं करता था AMH के बारे में.
अच्छा,
आजकल तो शुरुआत
सबके
ही
सब
AMH
AMH, AMH, AMH. Look, AMH just tell us the number of eggs. AMH does not tell you the quality of eggs. Problem is that when we are doing a IVF for a patient, the number of eggs, if we get more from a patient, the number of embryos are going to form more. If the
राइट.
number of embryos are going to form more, the chances of conceiving becomes high. Hence, we are talking about AMH. So when the AMH is low, so everybody is scared. What if she does not conceive and she has to land up for IVF? When she lands up in the IVF, her egg numbers will be less, the embryo formed will be less. The patient may have to go again and again through IVF. That is the only thing. But AMH per se, low AMH does not mean that you cannot become pregnant naturally. Give your chance, give yourself the maximum chance you can give, but don't overdo it. We need to be realistic in this. Supposing my AMH is 1, I am 32, 33 years of age. Give myself, because I know my AMH is okay, so give myself some 6 months or 9 months maximum to try on my own. Because if we look at age of 30, so average AMH should be around 2.53. 35, the AMH will be falling down, so it should be around 2. And if more than 35, the AMH keeps on decreasing.
राइट.
Purnima, I think you have some network issues.
कैन यू हियर मी मैम? डॉक्टर शालू आपका वीडियो फ्रीज हो गया है. Viewers, can you hear me? Please let me know in the comment box. डॉक्टर शालू आप दोबारा से रीजॉइन करेंगे? ओके. सो थैंक यू फॉर रिस्पॉन्डिंग। डॉक्टर शालू प्लीज आप दोबारा से रीजॉइन करेंगे बिकॉज आई थिंक नेटवर्क इश्यूज हैं आपकी साइड से। सो व्यूअर्स वी वर टॉकिंग अबाउट नेचुरल कंसेप्शन। जैसे कि डॉक्टर शालू ने बताया बहुत सारी चीज़ें हैं जिनको हमें ध्यान में रखना है। uh, हमें पता है कि आफ्टर 6 मंथ्स और 8 मंथ्स हमें लगता है कि प्रेगनेंसी नहीं हो रही, फर्टिलिटी स्पेशलिस्ट के पास जाएं। लेकिन अगर इन सब चीज़ों के बीच में फ्यू डायग्नोसिस, फ्यू टेकिंग ऑफ फ्यू सप्लीमेंट्स, कुछ ऐसी चीज़ें जो हेल्प करें हमें नेचुरल कंसेप्शन में, देन व्हाई नॉट दैट। इन सब के लिए फॉर नेचुरल कंसेप्शन, फॉर मैनेजिंग योर कंसेप्शन, वेदर इट इज नेचुरल, वेदर इट इज थ्रू IUI और IVF, प्लीज कनेक्ट विद अस। वी हैव मेनी इन हाउस प्रोग्राम्स। जैसे कि अभी बहुत लोगों ने पूछा योगा के बारे में, डाइट के बारे में, सो वी डू हैव number of programs in which through which we can help you to conceive naturally. Let me add her.
Hi, so sorry.
Hi.
I think something went wrong with my Wi-Fi for a second.
No worries मैम, it's fine. हाँ जी। सो हम AMH के बारे में बात कर रहे थे
Huh.
डॉक्टर।
So
हाँ
if
जी।
we look at the age of female who's around 30, so we expect some around 10, 9, 8 to 10x from her. So AMH should be around 2.5. This AMH keep on following every year. Around zero point 0.2 what that's been calculated, it's around zero point 0.2 per year the AMH falls. So supposing a female has a AMH of 1, it's not that the numbers are less. It's not that she cannot conceive because AMH only tell us the quantity. Uh, I'll give you in a very layman person's thing. So supposing you have gone to buy or apple to a place, okay, you know 50% of the apples will be good, 50% of the apples will not be good. So if you have the ability to only take two apples, it's 50-50. But when you have more apples, the chances of you conceiving becomes, if you buy two, only allowed to buy some four apples, so that means two
Hmm.
apples will be good, two apples will not be good, right?
Right.
Supposing if I'm allowed to buy 10 apples, so chances that five apples will come out to be good and five apples will not be come out to be good. So they same is with AMH. So if your AMH is low, so at a
Hmm.
female who's around 35, where I know 50% of the eggs will be coming out to be good and 50% of the eggs will not be coming out to be good. So if I get four eggs from her, so only two eggs will be normal.
Right. Normal.
You get me?
Right.
Second problem happens is that IVF is something which is happening outside the body, that is happening in the lab. So labs are not always, they are very good labs, everything is okay, but everything is happening artificial, so they can never give you 100% results. So if you get 10 eggs, so you're not necessarily going to get 10 embryos from them. Okay,
Right.
so everything keeps on decreasing. So if I get 10 eggs from a patient, so by the time I finishes, we go with the embryo formation and everything, I may just land up with only four embryos or three embryos from her.
Right.
Got my point? So if I get 15 eggs from some patients, so my embryo number will become almost 7, 8. With
बिल्कुल।
10, I have
Right.
3. With 15, I have 7. So her chances to conceive with these embryos becomes higher in a patient who has got more embryos. As a result of which, this AMH becomes a problem when we are thinking in terms of fertility treatment, or because we are thinking there may be a chance that you land up into IVF. So this is what we are talking about AMH. AMH only tells us the quantity. It does not tell us the quality. The quality of the egg is being spoken or told about by the age of the female. So if you are 30 years of age, 70% of the egg quality should be good. When we become 35 years of age, the quality becomes 50%. And when we cross 40 years of age, the quality is only 30% which remains. Hence, this is what we talk about it.
I think there's some network issue at my end. Can you hear me, ma'am?
I can hear you, Purnima. You can. We are not able to see you, but yes, we can hear you.
Some issue.
We can. Yes, we can
हाँ,
hear
I
you,
think
Purnima. Right.
ठीक है। I think we should continue
So
with
for the
this
females
only.
also, till
Hmm.
you connect Purnima, I can just tell, for the females also, eat healthy diet, stay healthy. Another thing which I want to stress to my viewers is Be stress free. Don't keep on thinking about pregnancy only. So a lot of time we are having a very good relationship with the husband, everything, and then suddenly we thought, "Okay, okay, let's plan pregnancy." We expect the results within 1 month or 2 months. If you're not able to get the results, you start becoming panicking on that, and every time it is going in your mind, ki, "Oh my God, should we try these days? Should we not try these days?" And you're just thinking in terms of having a pregnancy, planning a pregnancy, and not able to have proper natural intercourse or have a relationship. Secondly, when you have a fertile period, plan either the best thing is to do it daily, but again, daily becomes very tiring with all this kind of the work which we are doing, our office jobs and everything. So the best thing is to do alternate day rather than doing it once in 2 weeks or once a week. So the best option which comes out to be and which give us the maximum pregnancy rate to the viewers, and for when to a couple who is planning of pregnancy, try to do it alternate day at the time of the in the fertile period, before the fertile period, as well as apart from the once the fertile period is over, continue to do your relationship. It will not affect your pregnancy. So that time the frequency can be according to your needs.
राइट। सो आई थिंक कि बहुत सारी चीज़ें हैं, जैसे कि इन दिस होल कॉन्वर्सेशन द फर्स्ट इम्पॉर्टेंट फैक्टर इज कि डोंट वेट फॉर योर फर्टाइल पीरियड्स। सबसे ज़्यादा प्रॉब्लम तभी आती है जब हम ये सोचते हैं कि हाँ भाई इस दिन नहीं हो पा रहा, अब 15 दिन रुक जाते हैं या 14 दिन रुक जाते हैं, ये सबसे ज़्यादा ज़रूरी है। डॉक्टर शालू, आई थिंक कुछ मेरे कैमरा के साथ इश्यूज हुआ है, सो हम ऐसे ही कंटिन्यू करेंगे,
I
इट इज
think we
नॉट।
can continue with that. Not a problem, Purnima.
ठीक है, ठीक है, थैंक यू सो मच। सो डॉक्टर शालू, नेक्स्ट क्वेश्चन रिगार्डिंग दिस इज, वी डिस्कस्ड अबाउट एएमएच, नेक्स्ट इज व्हाट अबाउट एएफसी। लोगों को लगता है एएमएच के बाद एएफसी की बात की जाए, तो आप क्या सजेस्ट करेंगे कि हाउ
नहीं,
टू
देखो,
डू?
both the things go in, both the things go together. Yes, if you're thinking why you have to think about AMH and AFCs together. Look, AFC is what the number of eggs which I see when I'm doing a scan. Sometimes AMH, because we do it from different labs, and the lab the kits which be different. So if your image is low, you can do two images from a different two labs and get a proper reporting. Because sometimes the patient, lot of patients comes with the image value on the very lower side, but when I do a scan for them, they have a good number of eggs. And sometimes the patient comes with a good image value, but again when we do a scan for them, AFC is on the lower side. So again, these both the things are not they are like together. We need to do it. If you have a high AMH, you can just, and your periods are regular, maybe we can just ignore with the AFC if you're not conceiving. But if you have a low AMH, just get a scan done to AFC just to make sure that yes, what my AMH is saying is also corresponding with my AFC. And then we can understand this. Okay, we need to move fast now. It's not that it's the end of the thing. Okay, no, okay, my AMH low, I'm not going to become pregnant or nothing. It's the AMH. Just tell us the numbers. So that's the only thing which you need to understand. Ki AMH tell us the number, and it is just a guide to us. It is not to stress us up. Try properly, try naturally, follow the fertile periods. If you have doubt to follow the fertile period, you can get a scan done during day 10, day 11. LH kits come, they are the ovulation kits which come. I'll just there's a question which is coming, that what are the to increase the egg quality and the quantity. We know unfortunately we females are born with a certain amount of egg numbers, and we this is what we are born with, and that is like our insurance, and we can only use what we have. We cannot increase the on the quantity naturally, but yes, we can increase on the quality by, again, what I tell my patients is have lots of antioxidants, have lot of omega 3s, have you can have fish oil, multivitamins, vitamin D3s. This all improves in the egg quality. Plus, do not stress. Even if you have good AMH, good number of antral follicle counts, when we do pregnancy, we find that the patient egg quality comes out to be poor, and patients who have less number of eggs, who are not stressing, their quality comes out better. For the healthy lifestyle, again, that what I'm stressing, eat healthy. The most important thing is eat healthy, no smoking, no alcohol. The smoking, alcohol, and recreation drugs which any patient is taking, please stop those recreation drugs. And stress, do some, if you stress things stresses you out, try to do some deep breathing exercise, release your stress, go for your walking, use some hobbies which de-stresses you. So this is what you need to do. And again, laptop on the lap goes for both the husband and wives also. Sometimes I even tell them that when you're sleeping in the night, switch off your Wi-Fi's and the mobile datas also. Why have unnecessary radiation all over yourself in the house? And once you get up in the morning, you can switch in your Wi-Fi and iPad, and you will get all the information. Unnecessary, there's sometimes the patients, they have a habit of keeping their phones just on the side. Any sound which comes, they will just check on their phones. So this is also not natural. So just have a good night's sleep when you're having at least 6 to 7 hours, so that when you get up, you are fresh and you are more enthusiastic in everything.
Right, agreed, doctor, agreed. I think these are smaller tips but important tips. और कहीं ना कहीं हम आजकल इन tips को भूलते चले जा रहे हैं, and we are looking for the information all over Google each and every day. We are just searching for the tips जो कि शायद हमें पता है, but हम उनको अप्लाई नहीं करना चाह रहे अपने रोज की जिंदगी में. Uh,
And we need to understand one more thing: the chances that you conceive in one cycle or two cycle is just 15 to 20% chances. If we have 100 couples, then that it is for a year you need to try properly. That only they tell us, you need to try for a year properly, or 6 months, for maybe 6 months properly, and then only you need to come to a doctor regarding the infertility point of view. And remember that because we have achieved so much in our professional life, pregnancy, we think that when we try within a month or 2 months we'll achieve, and when we're not able to achieve the pregnancy in a month or 2 months, we started stressing about it. Guys, please don't do it. Only 15%, the chances that you conceive in a cycle is only 15 to 20%. That means if 100 couples are trying, only 15 will try. And there's a question which is coming which says ki my AMH is very low. Yes, your AMH is actually very low, 0.08. We can plan to give you some medications, see if any improvement is there. But here again, we need to see your antral follicle count. Do we can see any egg forming in the ovaries or not? And if there is an egg forming, we can think, okay, this is the time when you need to try naturally. So here it is quite low, the image, and we need to see the number of eggs which is forming. If we can see if egg is forming, because sometimes with this kind of a image also we do get 1 or 2 eggs do form in a whole year, provided your
right.
cycles are coming in a month or 2 months.
Dr. Shalu, one thing related to this AMH and donor cycle, we all know
Uh,
that few ART bill is coming and there are few changes in the donor cycle. So, what you suggest, like, because people are कि क्या होगा अगर डोनर साइकिल खत्म हो गया, तो क्या चेंजेस हैं जो
they're
आ
not,
रहे हैं?
like, they're not stopping donor cycles. They're not stopping. They are just saying कि just one donor for one person. It will be little costly for the patient, the donor cycles, because initially, because it's to find good donors, it's become little challenging now for us. But there's one thing which I do offer to my patients. I have a big chunk of patients who are poor responders, Purnima, whose image is less than one. So in these patients, I offer them some kind of like 2 cycles or 3 cycles. Like supposing if I can just form for the first cycle, if I'm able to form a good one A grade embryo, that means she has a good potential. Then I go forward and form two, give them a one more cycle or 2 more cycles, and we can have some 2 or 3 good embryos, and which can give them a fair chance of trying with their own gamete. And touch wood, I have got good pregnancies with that. So I'm quite happy. I tell my patients, try or this is something. Problem here is we cannot guarantee anybody a pregnancy. It's just we are trying our luck and the patient's luck here with the best, so that in the future we should not regret कि okay, I had not tried with my egg, because everybody in the end wants to have their own child. So for the patients who have less egg numbers, we can plan with a single egg also. Let us do one egg. Let us get the egg. If the egg is quality is okay, we see the embryo is good, we can plan one more cycle.
Right. And doctor,
And
we
then
call
we
it
have two
embryo.
embryos and then plan to transfer those embryos and then do it.
Right. So we can say that embryo pooling can help such patients with
Yes.
lower AMH.
Yes.
राइट। अच्छा डॉक्टर, एक बहुत और चीज आजकल आ रही है जिसको कि हम कह रहे हैं नेचुरल साइकिल आईवीएफ और नेचुरल साइकिल आईयूआई। व्हाट एग्जैक्टली इज दिस? क्या प्रोटोकॉल फर्क है या स्टिमुलेशन में फर्क है? व्हाट एग्जैक्टली इज दिस नेचुरल साइकिल मींस?
Purnima, natural cycle IUI is not going to gain us much because naturally, if husband's sperm is okay, she should have conceived naturally only. In IUI, we do not do, matlab, we are just enhancing the pregnancy by 5 to 10% from the what we are having it from naturally, provided the patient's tubes and the male factor is fine. But when we are doing a natural cycle IVF, there also we are just trying to, that it is said, the people who are very into the natural cycle, they say कि a natural, the egg forming, which is egg which is selected by the nature, it can give us a better embryo and a better chances of pregnancy without going through unnecessary injections to the patient.
And ma'am, exactly what is the success rate for this natural cycle and all that?
It's we now offer natural cycle to only the couples who have got very low egg numbers, that is somewhere
Oh.
like one or two. So in that case,
Mhm.
in case we get, it's all the success, it does not depend upon what I see initially. It all depends upon what kind of embryo I'm going to get from you. If I get a good
Right.
embryo, my success rate increases. If I don't get a good embryo from you, my success rate decreases. Because you see, this is the success is not depends upon me. The patient, it depends upon the patient, my strategy, and the embryo formation. When all the three rings come together, then in the center we have IV. Anything which goes away from the center, then our success is not happening. So we need to have all the three in together and make sure that the puzzle settles up, and then is the chance. So everything depends upon what is the embryo which I'm going to get from you.
Right. And ma'am, this question is related to abnormal periods. I won't say abnormal periods, but the flow is less. So what we can say कि fertility rate कम हो गया है या hormonal
No, we can
disbalance
just
है?
do one scan for her. This is a very perceptive kind of a thing. I may find that flow which is coming to me, the other patient may be finding it high, or the other person may be finding it low. In case we do a scan for this patient during the mid cycle, if the uterus endometrium lining is coming out to be normal, then we don't have to worry about this period flow being less. So it does not make a difference if she has a 1 or 2 day, as long as her endometrial thickness is adequate.
Right. So, Dr. Shalu, endometrium thickness you just mentioned, the one question related to this only, कि endometrium thin होना is very common problem nowadays. And what you suggest for such patients, do alternate therapies help in increasing the endometrium thickness?
Purnima, I have not seen much improvement, but yes, I do not tell patients not to do it. Because when the endometrium is thin and it's not coming to the mark what we are looking for, then the patients get very stressed about it. So I do tell them that if you want to you want to take a trial of a you want to take a trial of these ancillary or these medications or the therapies, go ahead and take it. It's not we cannot do it. Please go ahead. Anything which helps you in improving the endometrium, you do it. But in my practice, I have not seen much improvement here with the endometrium. So
Hmm.
in case a patient, I normally, if a patient has a during her natural cycle, she's forming a lining, anything above 6 7, it's okay for me, because 6 endometrium also do give us a pregnancy. Not stressing so much ki okay, yes, it's less, so we have to do it. Because again, when it comes up to be, it's very thin, it's not growing at all. It's like somewhere around 5 5.5. And then I do test for it to make sure that why it is coming. We need to make sure there is no infection in the uterus which is causing the endometrium to stay very thin. Sometimes tuberculosis, or basically it's infection which makes the lining thin. That is the reason we need to find out, make sure that there is no infection in the uterus which is causing the lining to be on the thin side. So when we do IVF for these patients, There are other blood tests which we sorry, there are other tests which we do to see the uterus lining receptivity when we're doing IVF. But when we're doing a natural cycle or when we're doing a IUIs, we do not let too much interference with the lining. We let the body take its course, and there are some medications, some things we do give to our patients to improve on the uh, lining thickness. But yes, that's all subjective. It depends upon patient to patient.
Right, agreed, agreed. Dr. Shalu, we all know that there are many cases related to tuberculosis infection also. So, people are somewhat reluctant to take medication for this. They said कि ये medicine बहुत खराब है, बहुत heavy है और हमको almost 3 to 6 months तक लेना पड़ेगा. So, क्या इसका इफेक्ट हमारी fertility पे भी पड़ता है when we are undergoing the treatment for tuberculosis?
Purnima, I don't. We don't normally give infection just by saying कि हमें लग रहा है. It has to be diagnosed before we give the tuberculosis medication. ये नहीं कि भाई नहीं तुम्हारी lining thin है तो इसका मतलब tuberculosis infection होगा. नहीं, we take a biopsy, send it for testing. And अगर उसमें निकल के आता है, then only we give it for the to find out the about the infection. Then only the tubercular drugs are given to the patients. Because if we give it like this, then the tubercular drugs has a lot of side effects. And why give unnecessary a drug when she doesn't need it?
Right,
So this is
exactly.
very important thing. And secondly, in case there is a tuberculosis in India is little prevalent. There are other infections also, but just to be on the safe side, we do the testing when there is a tubal factor or the lining is persistently on the lower side, just to make sure that it's not there. Because this infection, when we do plan a pregnancy, may not be helpful in pregnancy. But in the sense, I'm sorry, I'm trying to, when we're planning a pregnancy, then the conception may be less because there is some inflammation in the uterus. So this
Uterus.
inflammation may not be helping the embryo to stick in the uterine lining. But again,
Right.
everything is subjective because we have seen patients with lot of tuberculosis still conceiving and coming to us.
Okay, that's great. Dr. Shalu, one last question about male fertility. We know that for females, we need to check few parameters. There are many tests. एंड हमेशा यही होता है कि आप चेक कीजिए डायबिटीज तो नहीं है, आपका ब्लड प्रेशर कैसा है. सो व्हाट अबाउट मेल फैक्टर? अगर मेल को डायबिटीज है, मेल को थायराइड है, मेल को हाई ब्लड प्रेशर है, तो क्या वो स्पर्म क्वालिटी पे इम्पैक्ट करेगा?
Diabetes do affect on the male sperm quality because then the sperms are on the motility, the morphology, and the count of the male which decreases. And these drugs which they use for diabetes and the hypertension, they are and plus if they have a hypothyroidism, then this affect the libido more. So for the males, it affects their libido more, as well as the count, the motility, and the sperm morphology also decreases. But you need to understand because there are millions of sperms are there. Since the millions of sperms are there, something we the sperms do sometimes act, but only when they come to us with the fertility problem, we make sure that their health is absolutely fine when we're planning for a pregnancy. Because even if their sugars are uncontrolled, the sperm will be exposed to has been exposed to high sugars. So these patients normally form a poor embryo and may have a high chance of abortions also.
So we can say that male parameters are equally important when we
Equally
are
important. Very
planning.
true. Very
Right.
true.
डॉक्टर शालू, आईवीएफ के साइकिल्स हमें पता है कि एक के बाद एक करवाने पड़ते हैं. सो व्हाट शुड बी द गैप बिटवीन टू ट्रांसफर्स?
नहीं ऐसा नहीं है, वी डोंट डू इट एक आग के बाद एक, ऐसा देयर इज नथिंग लाइक दैट. So
ओके.
between the two transfers, we need to work around. Dekho, Poonam, my thought process goes like this. I've done a transfer for a patient and she's not conceived. If I put a good embryo for her, I have done everything to the perfect. So why she's not conceived? So that means something is not right. So I need to do
राइट.
it in a different manner the next time I do it. You see, my technique with the patient has not been successful. So we need to work around the technique. We cannot, if what if we give the same technique to her again?
Right, right.
My
So we need
my
to
initial
change the
technique failed, so
protocol.
I need to work around something different in a manner to make sure that it's give me a success rate there.
Right, agreed. So we cannot say, right, we can say that every individual is different, protocol is
Yes,
different,
very
diagnoses are
different.
different, and उसके बाद जो suggestions हैं diagnosis के बाद, that also differ from person to person.
Person to person. That is why you what that is why I have to sit with my patients when I see them. I give them my ample time to make sure that I go through everything of theirs, go through every paper to understand where they are going wrong or where I need to stress and how I need to work around so that it clicks on the pregnancy.
Right, right. So that's why we can say that if you are trying for natural conception, also diagnosis matters a lot. Do visit the doctor at right time, and as Dr. Shalu suggested in the very beginning, कि एज बहुत ज़रूरी है. एज के साथ आपको आगे बढ़ना है. यू डोंट वेट. आई नो कि बहुत सारी चीज़ें हैं. हम सोचते हैं चलो इस महीने नहीं तो अगले महीने. बट अगर आपको लग रहा है कुछ इश्यूज कुछ प्रॉब्लम्स हैं देन प्लीज विजिट योर गायनिक. एक नॉर्मल विजिट भी आपको बता देगी कि आपके क्या कंसर्न्स क्या इश्यूज हैं. डॉक्टर शालू आई एम सो सॉरी फॉर दिस वीडियो थिंग.
नहीं
आई
नहीं नहीं
डोंट नो
ठीक है.
व्हाट हैपेंड. एकदम से कुछ ऐसा हुआ एंड इट टर्न्ड ऑफ.
No, it's okay.
एंड we cleared the doubts regarding natural conception, diagnostic, and suggestions. Dr. Shalu, any parting note for our viewers, please?
I just want to tell it my patients that we have 12 chances per year. Okay, so if you're planning for pregnancy, you need to understand that we have 12 chances. Use the most of it because each chance will not give us a pregnancy, and per year it's just per month one chance for getting a conception. So if we lose that chance for the conception, then we plan for a next month or next month. This way we lose a whole year. And then when we sit together, oh my god, I've been trying for the pregnancy for a year. Nothing is happening. But please, whatever you have, plan it seriously, work around it, and don't be stressed about it. Nothing to be stressed, nothing there to be stressed about it. Just you need to work around it, understand how do you want to go about it. Eat healthy, stay healthy, go for your works, and please avoid junk foods, the cokes and the chips and all that stuff and eat, have some green, and please have a schedule. Not having a breakfast late or getting you're late, having late nights and then you're sleeping the whole day. Get your schedule on time, work whatever keep your work stress free. Try to be basically stress free and have a healthy lifestyle which will enhance your fertility.
राइट एग्रीड ऑन दीज पॉइंट्स एंड व्यूअर्स. जैसे कि हमने शुरू में बोला कि बहुत छोटी पॉइंटर्स हैं, इजी टिप्स हैं, यू कैन इजीली फॉलो दैट. अगर किसी चीज की जरूरत है दैट इज कंसिस्टेंसी. प्लीज फॉलो देम ऑन रेगुलर बेसिस बिकॉज कंसेप्शन इज रियली इंपॉर्टेंट फॉर यू एंड अस ऑल्सो. थैंक यू डॉक्टर शालू. थैंक यू सो मच फॉर ज्वाइनिंग एंड माई बैड फॉर दिस कैमरा थिंग.
नहीं, नहीं, ऐसा कुछ भी नहीं है Purnima. I'm just
एंड
missing your beautiful face and your smile.
Thank you, ma'am. Thank you so much. We'll definitely plan another session with you, and I
Sure.
promise कि उस time हम camera ठीक रखेंगे.
ठीक है.
So, thank you, ma'am. Thank you for joining. Thank you, viewers. And if you are in Delhi NCR, please do visit Dr. Shalu for any issues related to your pregnancy or your conception. Thank you, ma'am. Thank you for joining.
Thank
Thank you, UNS. Thank you. Okay, bye bye, ma'am.
Bye bye, Purnima. Thank you. I also like to thank you, UNSC, Purnima, the fertility dose, and my viewers for hearing me out. Thank you.
Thank you, ma'am.